So, what is that windlass mechanism you have probably heard about? If you have ever wondered why your foot starts to ache after long walks, why some people develop chronic heel pain, or how flat feet can affect your entire posture, then you're in the right place. I'm Eleftheria, and in this episode of The Science Behind Massage podcast, we're exploring the windlass mechanism, a critical yet often overlooked function of the foot that can make or break how we move. As a professional massage instructor, I've come across countless clients and students dealing with unresolved foot issues. And to be honest, I had to face it myself. After one of the more demanding hikes I took a few years ago in Vikos Gorge in Greece, one of those that tests every joint and muscle you've got, I felt a deep, aching discomfort in the arch of my right foot. I chalked it up to fatigue, but that wasn't the end of it. It lingered, affected how I walked, even how I stood. That's when I took a deeper look and began to explore the biomechanics of the foot. So, how that relates to the windlass mechanism? In simple terms, the windlass mechanism is a biomechanical process that tightens the plantar fascia. That's the thick band of connective tissue under the foot during the push-off phase of walking or running. When the toes, especially the big toe, extend as you step forward, this movement pulls the plantar fascia taut, lifting the medial longitudinal arch and stabilizing the foot. Think of it like tightening the rope on a pulley. That's essentially what's happening every time you take a step. This tightening supports the foot's arch and transforms it into a rigid lever, which is essential for efficient propulsion. Without it, the foot remains too floppy during gait, wasting energy and straining nearby structures. Now let's talk anatomy. The windlass mechanism primarily involves the plantar fascia, which runs from the heel to the base of the toes. The big toe, or hallux, plays a lead role. When it dorsiflexes, meaning it lifts upwards during the final stage of your step, the plantar fascia is pulled tight. This tension elevates the medial arch of the foot, stiffens the entire structure, and readies it for the next step. Supporting structures include the metatarsals, phalanges, and intrinsic muscles of the foot. Ligaments like the long plantar ligament and the spring ligament also contribute to maintaining foot stability during the gait cycle. The importance of this mechanism shows clearly in the way we walk. During gait, particularly in the toe-off phase, the windlass mechanism converts the foot from a mobile adapter to a rigid lever. Without the switch, walking becomes inefficient and strain increases throughout the body. Pronation, like the inward rolling of the foot, and arch behavior are closely tied to this. In healthy function, there is a balance. The foot pronates slightly to absorb shock, then the windlass mechanism kicks in to re-establish rigidity. But in flat-footed people, for example, that final stiffening doesn't happen properly. The fascia remains slack and the foot becomes unstable. Over time, this can lead to compensation patterns and pain, especially in the heel, ankle, or even up to the knees and lower back. If you're a physiotherapist, massage therapist, or someone deeply committed to holistic wellness, this mechanism matters, because foot dysfunction isn't isolated. It affects the knees, hips, pelvis, and spine. And when you understand how it works, you can guide your clients more effectively and with greater confidence. Before we get deeper, let me quickly tell you, I offer an affordable online massage class with certification. It's open to all levels of experience. Check the link in the description to book a class. Now back to the windlass mechanism. Let's connect it to a real-world condition you probably see often, plantar fasciitis. This is one of the most common causes of heel pain and is frequently linked to windlass failure. When the plantar fascia is overstressed, often due to faulty gait, poor footwear, or biomechanical imbalances, it becomes inflamed. If the windlass mechanism isn't functioning correctly, the fascia never gets the proper support and healing is slow. Clients with high arches or flat feet are especially vulnerable. Either the fascia is overstretched or it doesn't engage effectively, leaving the foot unstable. What populations are most affected? Athletes, especially runners, are at high risk due to repetitive load, but so are people with sedentary jobs who suddenly become active, those who stand all day on hard surfaces, and anyone with poor footwear habits. Also, people with diabetes or reduced foot proprioception often experience complications tied to poor foot biomechanics, including windlass dysfunction. So, what are the three major challenges with this mechanism? First, there is the tendency to overlook the windlass mechanism as one of several key factors in foot pain, especially when the presentation is complex or when symptoms appear to stem from other structures like the Achilles tendon or the calf. Of course, skilled physiotherapists and body workers will include windlass testing as part of a full biomechanical assessment. Second, there is compensation. When the windlass mechanism fails, other structures take over. The Achilles tendon, the tibialis posterior, the peroneal group, and that compensation creates a cascade of issues up the kinetic chain. I've seen clients with hip pain that traced back to faulty toe-off mechanics. And until the windlass is restored, the root cause remains untreated. Third, there's lack of client awareness. Most people don't know how their feet work, they just know when they hurt. That's where we, as professionals, come in. Teaching clients to mobilize the big toe, strengthen intrinsic foot muscles, and improve proprioception is foundational. But without understanding the windlass mechanism, these strategies can feel random or even ineffective. To make this more tangible, let's go back to my hike. After that sharp pain post-descent, I assessed my gait. I noticed that my right big toe didn't dorsiflex as much as the left, supple but telling. That meant my windlass mechanism on that side wasn't engaging properly. I started working on toe mobility, fascia release, and repatterning the push-off phase. Within weeks, the pain was gone. This wasn't magic, it was biomechanical correction. So, any practical applications? Well, as massage therapists or body workers, you can palpate the plantar fascia and big toe during passive dorsiflexion to assess if the mechanism engages. Watch the arch. Does it lift? Feel the tension. Does it increase appropriately? Soft tissue work, especially fascia-focused techniques around the medial arch and calf, can restore elasticity and coordination. Manual therapists can focus on tension patterns in the heel and forefoot, while physiotherapists might incorporate foot orthotics or toe spacers to eradicate the client's step pattern, although this should be done with proper care. For Thai massage practitioners, this ties beautifully with foot zen work and stretches that encourage facial engagement. In fact, techniques that open the plantar surface or stretch the posterior chain can indirectly influence how the windlass responds under load. Remember, the foot is the passive slab at the end of the leg. It's a dynamic, intelligent structure that adapts, responds, and where properly understood, supports the entire body. Before we wrap up, here's something you can try with your next client. Ask them to stand barefoot and slowly rise onto their toes. Watch the arch. If it doesn't rise, or if there is visible strain in the ankle or knee, chances are the windlass mechanism is compromised. From there, a targeted treatment plan becomes much clearer. Understanding this mechanism isn't just about solving foot pain. It's about improving posture, walking efficiency, and overall movement health. If you found this helpful, don't forget to subscribe to the channel for more evidence-informed insights into bodywork and manual therapy. And if you're interested in learning more, check out my massage books on Amazon. You'll find me there as Eleftheria Manzourou. Thanks for listening to the sound behind massage. I'll see you in the next episode.